Just before we open up for questions, I'd just like to pose a question to members of the panel each to answer fairly quickly in terms of what changes are necessary in other systems if the NDIS is to be introduced and is to be successful? Because at the moment, the way the Productivity Commission report stands, it leaves out housing, education, the health system, and places enormous reliance on mainstream services and the use of mainstream services. So what other changes might we need to bring about in those other systems or in the broader legal system to make the whole thing work better together? Bruce?
John, do you want to?
Well, I mean, I think one of the long-standing issues is, the whole issue around should we, without getting too far down the track, should we have special things for people with a disability at all? Should not society generally be shaped so that people with a disability can have fairly universal access to the transport system that everybody else uses, to the education system that everybody else has, and so on? So I suppose my point is that my starting point would be that the NDIS would take us a lot closer to that kind of framework, that perhaps the housing system would need to change along lines to allow for the kinds of things that Jim's described to be much more, universally put in place. And obviously, the education system needs to change in several important respects similarly. So it seems to me a lot of those things are around simple points like access, but the big sort of gorilla in this debate that none of us have spoken about is the workplace. And when you think about the modern workplace, one of the things that will be happening to the Commonwealth Government and all state governments is that employers will be screaming at governments for the next 10 years in Australia as to where are the workers, where are we going to get workers. So if we're not going to have very large-scale immigration and we can't get the people with the right mix of skills to immigrate anyway, then why aren't we making sure that we remove the barriers to people with a disability being able to enter the workplace in much larger numbers than they currently do? So it seems to me, while lots of areas of social and government service would need to change, the biggest thing that needs to change is the attitudes of Australians generally to their work colleagues and, I suppose, employers to their workers.
Chris, I mean, I think one has to start with the question about what are the boundaries of this scheme, and I think that the Productivity Commission has got that very right. It says this is about funding and structuring people's special needs in terms of their disability, and that necessarily then you have all the interface issues, as you say, with education, with housing, with health, with aged care, with the income support system. And I think what they say in the report, which I think is right, is that there needs to be detailed memorandums of understanding between the National Disability Insurance Agency and those other sectors. And so I think part of the answer will lie in the way those memoranda are framed and structured. But in thinking about it, I think, in addition to the point that John made, that we should never underestimate what the agency itself is going to be able to do to force change in those other systems that are going to be vital to the successful implementation of this scheme. As individuals, we have limited ability to advocate. As an agency with an annual budget of $12 billion, you have a very different capacity to advocate. You can write annual reports, you can quantify what some of these barriers are costing in terms of the scheme itself, but also in terms of opportunity costs. So I think the agency itself will become a huge force for positive change and deal with many of the issues that you're concerned about.
Rhonda?
Yeah, I mean, I ought to sound as optimistic as Bruce. The National Disability Strategy sits there as I speak. I think it's a very good high-level strategy that I hope you've all read. It's an intersectoral strategy, as it must be, because it's about changes of every system to do with disability. And it sits inside a functional department that's the department with the largest budget. It's one of the largest budgets. There was some discussion when we did the shutout report, the consultation, that there should be a disability office in Prime Ministers and Cabinet. The history of those offices is that they don't achieve anything because they have no budget. So sitting in FACSIA seemed a very good idea, and yet, you know, that leads to the dreaded construction called an interdepartmental committee. And if you've ever been in government, when an interdepartmental committee is set up between other government departments and you, it's a recipe for usually defensive nothingness. You know, people sit there defending their own patch, and they're very uncreative, unhelpful structures usually. So the thought of an authority with money is makes me very hopeful. On the other side, the Health Insurance Commission hasn't driven much change in health and medical issues where I think those paradigms needed to have been challenged. So I think it would have to be a very conscious decision on behalf of the authority that's proposed. The governance doesn't lead one to think that that would be likely to come from the governance, as the governance that's proposed is mainly around financial and fiduciary responsibility, not around innovative intersectoral reform. So I think that something would need to be done to really have that as an imperative of that authority. As it sits, it wouldn't happen. And of course, the system, because the trouble with work, John, is that it's not it's a system of a kind, but it's not a system that government has done much about in a very systematic way, if you know what I mean, including not even employing in their own right, so that the numbers employed by the Commonwealth Public Service have halved in the last 6 years of people with disabilities instead of increasing. So that would be a system that one would think could be fixed fairly easily, but hasn't been. The education system is the one that I'm hoping there would be maximum pressure on, as there needs to be major reform in that system, which currently does not focus on the learning and development needs of children with disabilities at all. It focuses on disability, which is a completely different topic. And by not focusing on learning and development of all students, it means that programmatically you cannot go to school and expect anything, particularly if you have a child with disabilities. And I include all schools in that brief summation. So look, I would love to see this, and clearly it will be, but it would have to be a bit more conscious. And in fact, it makes me think, Bruce, that that's something the independent panel should push on, as well as, we've got to run up till the submissions are cut off, and really having it structurally embedded, that body takes on as its task reform in other systems, I think would be a major requirement of it. And really we should put that on the agenda as well, because I don't think it's there as we speak, except in the size of it, which doesn't necessarily yield the results you want.
I've made a note, Rhonda.
Yeah.
I'd already made a note, but it's now been underlined.
Do you have some thoughts on that?
Well, I think the kind of interaction that Bruce describes makes sense. I rather suspect that one of the things that's also needed is a progressive approach to anti-discrimination legislation, so that services that are provided for the general population are very clear that they're provided for the entire population and not for those bits of it that they choose to select. I served on the Committee of Inquiry in England after the death by indifference case, in which 6 people with intellectual disabilities died in general hospitals in conditions of appalling maltreatment and neglect. And when that committee first started working, many of the medical professionals appearing before it wanted to argue that this was a disability issue. And it was an absolute light bulb moment when the committee realised that it was actually a legal issue. The law in England requires public bodies to take reasonable steps to adjust their provision to the needs of people with disabilities, just as it does in relation to people from ethnic minorities. And these hospitals were failing to meet that legal duty. I have never seen such an effective response in the National Health Service as the report of that committee. Every single hospital trust in England has been working like fury because it's technically in breach of the law until it makes reasonable adjustments. Far more effective than any of the reports about disability and healthcare that we've had over the years. So I think that the new organisation will be very potent for the reasons Bruce has given, but I wouldn't give up on that overarching legal framework that increasingly needs to define it as the responsibility of everybody in society to make reasonable adjustments so that people with disabilities can live their lives.
Thank you. We have time for some questions. If you have a question, please put your hand up. There's some people roaming with the mics. There's Bruce Wood over there in the corner. And the second one, John, here. Okay, John first, Brian first.
Thank you. It's actually not Brian, it's Julia Gillard. And I'm thinking of the beginning, the now famous beginning of the PC's report, which described the current system as inequitable, underfunded, fragmented and inefficient. And I would venture to suggest that a lot of Australians would regard the health system in exactly the same way, and yet it is an entitlement-based system. It uses the same approaches, holistic care, carefully described points of access, things like early intervention, and most particularly, it endorses the notion of reasonable and necessary care. So I'm thinking particularly of Bruce and John, because you're the political animals. I'm Julia Gillard. How can you convince me that the NDIS will not take us into the same sets of problems that the healthcare has encountered?
Well, I'd still make the point, more than anything else, that whatever problems people believe exist in the health system in Australia, they are dwarfed compared to the problems in the disability system. The same can be said of the education system and every other area of social policy. So while you can select failures within the health system, the overall point, which is that the health system is well resourced compared to the disability system, is, I think, a no-brainer. The health system is adequately resourced. You can argue at the margins 2 or 3 or 4 or 5% a year, but you're not arguing 50% a year, which is what the difference in the disability system is. That's the first point. I think the second point, which is, I think, quite important, is that there's a massive cost to doing nothing to this with disability. If we leave the systems to continue to overheat, as the Productivity Commission indicates they are, so by overheating I mean when there's complete system failure, so when one narrow example is for when respite services break down, that means you get a massive knock-on effect, which then starts causing family breakdown, which causes more occupation, permanent occupation of respite beds, more blockage, less respite available, more families going to crisis, and so on. So that just happens when the system is rationed and underfunded, almost as a matter of cycle. That'll happen every 3 or 4 years in each state.